All right, everybody. Today we're going to talk about acid-base balance. And again, we're going to be just talking about the very basics. We could go on and on for hours on this. In fact, I'm sure most of your programs have a lecture that might feel like it's hours and hours, but I'm going to tell you this is one of the most difficult concepts that students have. And so hopefully what I can do for you today is just break down the very basics of acid-base balance. Now, there is a whole another time frame that we could spend on interpreting blood gases. And in fact, I'm thinking about doing a video on the very down and dirty things you need to know for evaluating acid-base balance. But let's learn the foundations of it first. So what is acid-base balance? So acid-base is a very delicate balance of systems. Any slight change in these shifts of acids and bases can cause organ malfunction. And so it is a very narrow window. It's a very small area to which to work with. And so the body does a very good job on an everyday basis to kind of keep this checks of balances. And so it involves a lot of different processes, but hydrogen ions, different buffers, certain types of body fluid, organs such as the lungs and the kidneys particularly, as well as potassium, all play a role in this. So let's talk a little bit about hydrogen ions. Your hydrogen ions will determine the pH level of your body. And so this is the number of hydrogen ions that are found throughout the body fluid. Normal range, again, very tiny window of range, and it's 7.35 to 7.45. The number of your hydrogen ions will always determine whether or not you're in acidosis, alkalosis, or you're in a neutral state. And so hydrogen ions in the presence of acidosis drives the body fluids down. So that's a pH of less than 7.35, whereas alkalosis is greater than 7.45. So let's talk a little bit about what acids are and what bases are. So acids happen to be the end products of metabolism. So after your body has used up everything that it needs, these are all the things that are quote unquote left over. And of course, they contain hydrogen ions. The more hydrogen ions we have, the more acidic that we are. Acids are also considered hydrogen ion donors because it has so many of these hydrogen ions. It's able to donate or give up hydrogen ions, whereas bases are the exact opposite. They have no hydrogen ions and they are considered acceptors because they don't have any within their makeup. They are allowed to accept in order to drive down the pH of something. The most common base that we have in our body is bicarbonate, and we typically like that range to be from 21 to 28. Again, relatively a narrow window of error for these lab results. So your body does a very good job of keeping it in check in these small windows of range. All right, so let's talk a little bit about buffers, not to get too in detail because we could literally be here all day just on buffers. So we have to know that it's a regulatory system. It provides immediate protection from whatever is offending or causing the issue within the body. It will cause the body to either absorb or release the hydrogen ions. Okay, so again, the buffers keep that body's pH within range of 7.35 to 7.45. So one of the things that it will do is it will take the excess hydrogen ions to the lungs in order to be exhaled out of the body as carbon dioxide. Now, here's the interesting thing about the body is once the primary buffer responds, it gets consumed by the body, okay? So this is where our body gets into trouble because if we continue to have that offending substance, the thing in our body that's causing our pH to get out of whack, what happens is these primary buffers get all consumed up, the body uses it all, and then that leaves the body unable to respond until that buffer can be regenerated. So this is where our patients get into trouble is because they've buffered, and they have nothing left to buffer. Some of our primary buffers, and we're not going to get into detail of this because again, this is just a very broad overview and the basics of acid base, but our hemoglobin, our plasma proteins, our carbonic acid and bicarbonate complexes, and then there is also a phosphate buffer within the body. So let's talk a little bit about the lungs. Though we just talked about the primary buffers, this is considered a secondary buffer. So this is after the body has used up all those resources, it then turns to the lungs to kind of help correct some issues. So it's called the second line of defense. It works in reverse to help regulate excess or deficit. It takes about 10 to 30 seconds, so it has a very quick response time to any sort of abnormality within the body. And so we have two different states, right? We have an acidotic state or we have an alkalotic state. And so what happens in acidosis is we have a low pH, right? So anything below that 7.35. So what happens is the respiratory rate and depth will actually increase or speed up in an attempt to exhale out all those acids. Because remember, what happens is the excess acids get sent to the lungs and they get exhaled as carbon dioxide. Now, in a state of alkalosis, the exact opposite will happen. Our pH goes up, so higher than 7.45. And then what happens is our respiratory rate and depth actually decrease because our body wants to hold on to the acids. Because if we're alkalotic, we want more acids in order to drive down our pH. Hopefully that makes sense. The next organ responsible for any sort of buffering is the kidneys. Now, I absolutely love the kidneys because I believe they are one of the most important organs in the body. Everybody instantly says heart, lungs, and brain, but I challenge you that the fourth one would be kidneys. So our kidneys are actually a little slower in their response time, but they do a much better job of buffering any acid-base abnormality. Okay, and so it all comes down to the regulation of bicarbonate, which happens in the kidneys. In the presence of acidosis, so we know that our pH is lower, then what happens is our body determines to get rid of that excess hydrogen by excreting it in the urine. So again, we get rid of those hydrogen ions, which causes the acidosis, by peeing or urinating them out of the body. Now, the exact opposite happens in alkalosis. So we have that increase in pH, which means we don't have enough hydrogen. We have too much bicarbonate. So what your body will do is it will release that excess bicarbonate in the urine in order to drive down the pH. So basically these kinds of systems work in reverse. So the next thing we have is potassium, and potassium actually plays what we call an exchange role. And that is because depending on if we're acidotic or alkalotic, the hydrogen ions will either be pulled into the cell or we will push hydrogen ions out of the cell. So what happens in acidosis, remember this is the pH that is low. What we want to do is we want to move the hydrogen ions out of the bloodstream and we push them into the cells to help buffer. When the hydrogen ion moves into the cells, it causes potassium to come out of the cell. When the potassium comes out of the cell, it goes into the bloodstream. And when it's in the bloodstream, our potassium levels go up. All right, when we go back to fluid and electrolytes, if you watch that video at all, I told you with electrolytes, when something moves into the cell, some sort of electrolyte has to move out of the cell. So this is exactly what happens in potassium in the presence of acid-base balance. So in alkalosis, what happens is the hydrogen ion moves out of the cell. It moves into the bloodstream in an attempt to bring down the pH, because remember the pH in alkalosis is up. So it pushes the hydrogen ion out of the cell, which means the potassium gets to move into the cell because there has to be an exchange within our cells. And because the potassium moves out of the bloodstream and moves into the cell, that causes our circulating level of potassium to drop. And hopefully that makes sense. And the good thing is that you have this on video. So you can go back and listen to this a couple of times in order to get the process of it. Because once you understand this is an exchange from the cell into the bloodstream or the bloodstream into the cell, it all makes perfect sense. And you can quickly identify it on any test. So let's very quickly talk about the four main kind of disorders that go along with acid base. So we have respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. And so this is just a very brief overview of what these are, how they work, et cetera, et cetera, et cetera. So let's first talk about respiratory acidosis. Respiratory acidosis is in the name. It's all about the breathing. So it's acidotic. What happens is there's too much acid, not enough base, so the pH is low. So the pH is below 7.35. Now, there's two different causes, overall causes. Now, there's a whole list of things that cause respiratory acidosis, but there are one of two major categories. It's either because there's a defect in function, so the lungs are not functioning like they should, or there's some type of obstruction in the airway, like mucus or a tumor or some sort of thing that's restricting the airway. All right. And the interesting thing is we're not getting into acid base and interpreting blood gases, but just very quickly know that the pH and the PCO2 move in different directions. So when the pH is low, the PCO2 happens to be high. So that's just all this little man is telling you. But he says, I can't catch my breath. So that's 100% respiratory acidosis. So what does this look like in our patients? They're lethargic, they're confused, they're dizzy, they have a headache, and if we've ignored all those symptoms, we will advance into a coma. Cardiovascular-wise, these patients will have a drop in their blood pressure. They typically have cardiac dysrhythmias or heart rate abnormalities. And then they have this warm, flushed skin because what happens is there is a peripheral vasodilation that occurs. Neuromuscular-wise, it can advance to seizures. And then respiratory, again, there's that increased rate and depth of respirations because your body's trying to get rid of acidosis. It's trying to blow off that excess hydrogen ion. In the later stages, it will revert to hypoventilation just before your patient completely quits breathing. So be aware of those symptoms. On the opposite side of this, we have respiratory alkalosis. That means the pH is too high, so we don't have enough acid, but we have too much base in our system. What happens with this is it's an overstimulation of the respiratory system, so the patient tends to breathe faster. Think of those things that cause you to breathe faster. Fever, hypoxia, when patients are in pain or when they're having severe anxiety, the respiratory rate goes up. Symptoms that you'll see, again, if you do a panting breathing pattern, you're going to notice you get dizzy and lightheaded, maybe even some confusion or a headache. For cardiovascular wise, again, the blood pressure drops, the heart rate goes up, and there's a potential for some cardiac abnormalities. In the GI system, we tend to have nausea, vomiting, or diarrhea, or maybe even some pain in the stomach. Neuro-wise, we have tetany or numbness, tingling, hyperreflexia, and again, seizures. And then respiratory rate, remember when we're talking about the lungs, when we're trying to drive down the pH, because in respiratory alkalosis, the pH is high. When we're trying to get that pH lower, our respiratory rate will decrease in depth and rate. All right. Metabolic acidosis, again, this is too much acid and we've lost too much base. So what happens is our body is holding on to too much acid, which is where the acidosis comes into play. Again, causes can be diabetic ketoacidosis or DKA, probably one of the most common. It can be an ingestion of too much aspirin, high-fat diets. This is almost like the ketoacidosis or the keto diet. We do a high-fat diet in the keto diet. So these patients tend to put themselves in a slight metabolic acidotic state. Malnutrition or kidney disease and even diarrhea can cause these. So some symptoms of metabolic acidosis, again, lethargic, confused, dizzy, headache, coma. Hopefully you see a pattern happening here. Cardiovascular, low blood pressure, dysrhythmias, cool and clammy skin, because in respiratory acidosis, remember there's vasodilation. In metabolic acidosis, it becomes vasoconstriction. Nausea, vomiting, diarrhea, again, the abdominal pain. There will be muscle weakness. And then the respirations, again, because remember this is acidosis, the respiratory response is going to be to speed up these deep, rapid respirations, also called Kussmaul's, which is found in DKA, which is a whole nother subject for a whole nother day. But again, in the presence of acidosis, our lungs are going to speed up initially in order to blow off that excess acid. So deep and rapid respirations. The last disorder I have for you here is metabolic alkalosis. And again, this is because we have too much base or too much bicarb hanging out and we don't have enough acid. Reasons for this may include diuretics, excess vomiting, nasogastric suctioning, a disorder called hyperaldosteronism, infusion of sodium bicarb because we have too much bicarb, or this can also happen due to excess blood transfusions. What does this look like? You guessed it, neurological wise, they're lethargic, they're irritable, confused, and possibly a headache. Cardiovascular wise, we have a drop in blood pressure, tachycardia, and some cardiac dysrhythmias. Gastrointestinal, this would be a loss of appetite, nausea, and vomiting. Neuromuscular, there could be tetany, tremors, tingling, muscle cramps, hypertonic muscles or seizures. And then again, remember, in a state of alkalosis, there is a decrease in respiratory rate and depth, or also known as hypoventilation, because your body wants to hold on to some of those acids. So, like I said, this is quick and sweet and a very overview of acid-base balance. I'm thinking about doing another video just to learn how to interpret blood gases, because that's going to be a whole nother thing. Looking at these disorders from what causes it and what this looks like in our patient is one thing, but being able to look at a physical blood gas and to interpret kind of where your patient's going to go before they get to the seizures, before they get to the coma kind of thing, will equip you to be able to understand those a little bit better. Plus, your nursing test as well as the NCLEX loves to ask you about acid-base balance. So, hope you found this valuable. Leave me a comment if you did, or share it, or all that fun stuff. Let your friends know. But anyways, I'll talk to you guys later, and take care.